Methemoglobinemia by Janet Mahold, case study. Methemoglobinemia is a rare congenital or acquired blood disease that occurs when red blood cells contain methemoglobin at levels higher than 1%. Methemoglobin results from the presence of iron in the ferric form instead of the usual ferrous form. This results in a decreased availability of oxygen to the tissues. Parts of the body affected. When a person is affected by this genetic trait, a large portion of the integumentary system is affected, turning the skin a blue or gray color, and it also can affect the eyes and nails. Methemoglobinemia is a blood disorder in which the body cannot recycle hemoglobin after it is damaged. Hemoglobin is the oxygen-carrying molecule found in red blood cells. In some cases of methemoglobinemia, the hemoglobin is unable to carry oxygen effectively to body tissues. There are two forms of inherited methemoglobinemia. The first form is passed on by both parents. The parents usually do not have the condition themselves, but they can carry the gene that causes the condition. It occurs when there is a problem with an enzyme called cytochrome B5 reductase. Type 1, also called erythrocyte reductase deficiency, occurs when red blood cells lack the enzyme. Type 2, also called generalized reductase deficiency, occurs when the enzyme doesn't work anywhere in the body. The second form of inherited methemoglobinemia is called hemoglobin M disease. It is caused by defects in the hemoglobin molecule itself. Only one parent needs to pass on the abnormal gene for the child to inherit the disease. There is also an acquired methemoglobinemia. Acquired methemoglobinemia is more common than the inherited forms, and it occurs in some people after they are exposed to certain chemicals and drugs, including anesthetics such as benzocaine, benzene, certain antibiotics, nitrates. The condition may also occur in infants who are very ill who are fed too many vegetables containing nitrates. Symptoms. Symptoms are proportional to the methemoglobin level and include skin color changes and blood color changes at levels up to 15%. As levels rise above 15%, neurological and cardiac symptoms arise as a consequence of hypoxia. Levels higher than 70% are usually fatal. Symptoms can include seizures, bluish coloring of the skin, nails, and lack of energy. Exams and tests. Methemoglobinemia can be diagnosed with a blood test. A baby with this condition will have a bluish skin color, cyanosis, at birth or shortly afterward. Arterial blood gases and pulse oximetry tests may be done. Top treatment. A medicine called methylene blue is used to treat severe methemoglobinemia. Note, methylene blue may be dangerous in patients who have or may be at risk for a blood disease called G6PD deficiency and should not be used. To read more on the story, go to abcnews.go.com, Health Blue, Skin People, Kentucky. Benji Stacy was so frightened, maternity doctors, with the color of his skin, as blue as Lake Louise, that he was rushed just hours after his birth in 1975 to University of Kentucky Medical Center. As the transfusion was being readied, the baby's grandmother suggested to doctors that he looked like the Blue Fugates of Troublesome Creek. Relatives described the boy's great-grandmother, Luna Fugate, as blue all over and the bluest woman I ever saw. In an unusual story that involves both genetics and geography, an entire family from isolated Appalachia was tinged blue. Their ancestral line began 6 generations earlier with a French orphan, Martin Fugate, who settled in eastern Kentucky. And again, this is a story on ABC News, or if you just Google blue people, you will find that story. Thank you for listening to my presentation.